Hi, Christy. It's really nice to be together and have a chance to talk about how we work as clinicians. And I'd love to know something about your approach when you're working with clients.
Thank you. Thank you for inviting that question. When I'm working with clients, my approach is, I would say, multifaceted. My approach is not just one, because I'm an integrative psychotherapist. My approaches are integrative. So what that means essentially is that I'm pulling from different approaches and the strengths from each approach and how they also connect and work with one another. Say how emotion focus works with attachment, works with psychodynamics. So oftentimes I'm looking at several approaches to a client, and that's how I base treatment and base even a deeper understanding of their history, their past, who they are as a person. And I look at various theories of development. I look at the idea of the person as a whole. So the sense of how they are embedded and connected to the whole system, the world, the environment, family, society. So my approach is very broad and very whole in a sense.
But also what I really love about what you're saying is that even though you're drawing on different therapeutic approaches and that it's broad enough to include the person's context and culture and life experiences, what you're also doing is tailoring your approach to the specific needs of that unique person in front of you. So it gives you all of this amazing abundance of material to bring to the unique qualities of the client.
Yeah, that's a really beautiful way to put it, that it's actually tailoring and catering. It's not one method where it's just, okay, we're going to just talk today and look at your beliefs and look at why you think that, or try to find strategies or ways or skills to cope better. It's actually looking at how you actually function in your world, and then the kind of interest in one's own inner experience and inner world and how they've become who they are, really.
Yes. And so that kind of intervention would really help clients who feel like they keep doing the same things or having the same kind of relationships or the same kind of difficulties. And it's really puzzling then to why I keep, dating these same type of people that always hurt me in the end, or why I can't really find satisfaction in my work life, or, those kind of things which are so troubling because you can't get a grip on what's actually happening.
Yeah.
And as you say, some of those kind of more manualized treatments, which are just about the behavior, they can be really effective for some things and some people, but they don't work for what you're talking about, which is that deeper kind of how have I arrived at who I am now? What is mysterious to me? What do I need to kind of feel more alive to and accept in myself so that I can actually make pretty revolutionary changes to both my insides and my outsides? Is that kind of coming into your practice in that way, that you sort of see people transforming?
Yes, absolutely. Yeah. It's about the person, the evolution of the person, and really those who come to therapy and want to work on those dynamics and see those patterns and go, oh, why am I stuck in this? And why is my life not changing? Or why do I continue these habits? It is quite a transformative and revolutionary, in a sense, experience to work on yourself and to commit to that growth in yourself. And at the same time, it brings up, sometimes it touches on things we've missed out on or things we haven't had, and it helps us to make sense of who we are. because we haven't maybe understood the patterns and seen them maybe from another person's perspective, seen them in how we show up in the relationship when we meet a therapist, which is a very unique experience, meeting someone in a space that doesn't know your past, is very unbiased, and helps you to kind of understand your story.
And what I really love about what you're saying, Christy, is that sense of when we are struggling or quite distressed, we get very trapped in our own thinking. And so that liberation piece is having somebody else bring a perspective, like gently and with respect, that sort of can alter the kind of thinking pathways that you've just become really accustomed to. So there can be like a great sense of relief, can't there, in just seeing a different path or a different approach to your difficulties. I think that's a really key part of therapy.
Yeah.
The other thing I'm curious about, Christy, is your work where you incorporate the integrative approach and your background in yoga teaching and body work. Would you be able to tell me a little bit about how you use that?
Yeah, it's kind of you've linked it at almost the right moment, because you've said this thing about this point of difference and understanding our thinking and understanding that in relationship to other. And the thinking is deeply connected to the emotions. We sometimes think they're separate, but the thinking comes in sometimes when we're connected into emotion, and that changes or alters our experience of ourself, or maybe reminds us of something. And so when it comes to any work that we do, which is either spiritually based, mindfulness, meditation, more focused or centered on the body, we can actually understand even our thinking better, because we start to slow that, quiet the mind that is constantly formulating, analyzing, ruminating. So we move into the body in that very somatic, felt capacity. And so that allows this dynamic between an inner dialogue, having that with self. So we have that with our therapist, but in someone's spiritual, body-based practice, they start to really learn, understand, and develop what's right, what feels good. Am I safe in my body? What are my emotions right now? All these questions that arise. So what I'm doing in the space of therapy is utilizing my knowledge and my experience of holding people through that and understanding that in myself, to help them to access more that inner trust, inner knowing. Yeah, it's about learning. It's about a deeper sense of knowing oneself.
When you talk about that, it brings to mind how a lot of the ways that we live now take us away from our body. So I was just thinking about, that sense of when you remind someone in the moment where how you're actually feeling in your body right now, when you're talking about that. In lots of ways, when we go to work or we're with our family, we've taught ourselves to make those things less important. We kind of stop noticing them or push them down because we have to be doing something. So what it sounds like is you're helping people reconnect with self through the body, and that there's a simplicity, almost like if you can feel it in your body, it's easier to find the road into the true emotion. Is that kind of the right territory?
Yeah, there's a sense of the building of trust, knowing your body, being comfortable in your body. Absolutely. Yeah, you definitely have it right on. It's this sense that the more I am in my body, the more I'm tuned in, the less I numb out or push away uncomfortability, negative emotion, the more I'm likely to move towards perhaps mechanisms that aren't supportive of my well-being, my vitality, feeling good. So it's tapping into really feeling. And that's really what therapeutic work is getting into the feeling space. And we can't do that without the body, without having an understanding and a relationship to our body.
Thank you, Christy. I feel like out of this conversation, I have a really beautiful beginning point to think about what it'll be like to work with you, and your clients are very lucky. Thanks, Christy.
Thanks so much, Emma.